Hello. We're going to try another effort here. I filled up my memory on my card. So we're going to talk about perhaps the greatest travesty in American history as far as how we're dealing with this COVID situation in America. I'm not anti-vax. Many people have reached out to me to address this issue. I've written about how COVID, the mortality rate does not rise to the level of mandating a vaccine. Um, and some of my other videos discuss that in some of my articles. But I talked to my doctor some years ago about taking a flu vaccine, and he told me about all the benefits of the flu vaccine. And then I said, "Well, do you take the flu vaccine?" And he said, "No, I do not." I said, "Well, doctor, why don't you take the flu vaccine?" He says, "Because I prefer to develop my immune system naturally." Now, I don't know if that's sane or not, but as a farmer, that's what I've done for the ensuing years, and I've never had the flu shot. I can tell you what happens when you don't take the flu shot. You get the flu. Not every year, but every once in a while. And it does knock it out of me. But why would I get the COVID vaccination when flu is more deadly than COVID for me, for my age group? And that's what we're going to talk about, this insanity of sacrificing our children's futures for a disease that really targets very elderly people. And that's a very serious matter. I'm very aware of that. But when COVID struck, nobody knew what the mortality rate was going to be. It looked in Italy and places in Europe like it could be as much as 10%. I was monitoring there at that time, and we had family and friends there. But it's been difficult to get accurate science data. But we have that now. And But we now know that we shut down our businesses and our schools and impose this crushing burden on our children for a disease that really doesn't threaten them. The science suggests that the elderly should be held in sheltering in place while the rest of the world continues. We've had a pandemic like this before with the AIDS epidemic in the 80s, when prejudices against gay people left America sort of standing there like deer in the headlights and not responding. In fact, the first article I ever had published was in the Connecticut Law Journal in about 1986 or 7, advocating to give free needles to addicts to prevent the spread of AIDS through the IV drug population into the heterosexual population. It was actually a gift that we had a heterosexual disease confined to a gay population and an IV drug using and a prostitution population, that we could have tried to contain it there, but we didn't. And that folly was that it spread around and ended up killing hundreds of thousands of people that could have been spared. Now we have this opportunity. Are we doing it again? Are we doing it again through fear or prejudices, not treating this disease in a way that is scientifically the best way forward? So this would be a bigger area. And there's this cultish religiosity in people saying, "Oh, but you'll kill grandpa. If you don't wear a mask, you'll kill everybody." We don't actually even know that. I wear masks, not the issue. But we've dragged this response out from flattening the curve to permanently damaging children's future. Where did we have that discussion? Their psyches, to protect elderly people. It seems really upside down. So nobody wants anybody to die on a ventilator, but arguably doing this puts those people at greater risk. And some say we don't know if we develop herd immunity through children, whether that will protect the elderly people. Meanwhile, we sit around waiting for a vaccine that we don't know will work or protect people, and we're told that people can still carry it even after they are through with the vaccination. This total reliance on pharmaceutical companies seems highly suspect to me. So human deaths from disease are indeed a concern, but so are deaths of businesses, like the New England Culinary Institute and Cheers and thousands of businesses across America and in Vermont. 1 in 4 businesses have estimated to be destroyed by COVID. Death from COVID is real, but so too is death from domestic violence, from starvation or suicide or opioid overdoses. Death is final. It's very real. And so too can be the mental health damage to millions of children who are already suffering from a cacophony of anxieties imposed on them by a political ideology that subjects them to active shooter drills, which studies show can traumatize children as much as being in an active shooter drill. Would you do an active rape drill? Telling all of our children that the world's going to be gone in 12, is it now 10 years, creates huge anxiety. Already they've been sort of conditioned to be in a state of psychosis, and now we're doing this with COVID. And I talk to parents, their children are being traumatized, many of them, young children. The CDC, though, reports as of December 28th, 61 total U.S. COVID mortalities for children under 4 and 142 for ages 5 to 17 out of 232,558 deaths. This translates to 0.026% of mortalities for under 6s and 0.061% for 5 to 17s, excluding those healthy kids who didn't even get tested or diagnosed. They're not even in these statistics. So the overall COVID mortality rate for healthy children approaches zero, notwithstanding that we now apparently have nobody dying in our hospitals from flu anymore. If you've looked through the COVID analysis data throughout the last year, just nobody dies of flu anymore, according to the CDC's data. Now, am I saying those flu deaths are being counted as COVID deaths? No, I don't know the science, but it sure seems scientifically sketchy that flu disappeared. Now, that makes COVID look worse than flu, doesn't it? Especially for children. But in a pre-new normal year, in a normal year, 100 to 200 children under 18 die of flu. And in fact, it was 282 in the 09 to 2010 season. So reports have also, here's a quote, reports have shown that about half of children who die from the flu each year have no known risk factors for flu complications. COVID, on the other hand, though, in children, we have only one really good study, and it contrasts sharply with flu. It found that 85% of children requiring intensive care for COVID had comorbidities. In other words, only 15% of them were healthy. So COVID-19 is less deadly than flu to healthy children. Flu is much more deadly than COVID to healthy children. Motor vehicle crashes in 2018 killed 636 children, 12 and younger, and injured 97,000 more, killed 2,500 teens, and 285,000 were treated in emergency rooms. This is according to the CDC. Don't we still let teens drive? More than 20,000 children suffer traumatic brain injuries each year in playground injuries, according to the CDC, and another 200,000 into hospital. Now, granted, those aren't injuries that spread like a disease, but this disease is not spreading through children, so why are we shutting them down and terrorizing them? Farmers, we let our kids drive tractors when they're 12. That may sound crazy, but it's called controlled risk. And our immune systems require the same thing. They are actually threats to our immune systems by being so isolated for so long, by weakening their resistance and the development we have through various bacteria. Weakened bad bacteria, but even good bacteria. We need good. We can't live without bacteria. The CDC purports to be aware of this and writes at one website of its websites, coronavirus disease can affect children and young people directly and indirectly. Beyond getting sick, many young people's social, emotional, and mental well-being has been impacted by the pandemic. Trauma faced at this developmental stage can continue to affect them across their lifespan. But just keep traumatizing them, right? Because at another page of the CDC says children, like adults who have COVID-19 but have no symptoms, can still spread the virus to others. Most children with COVID-19 have mild symptoms or have no symptoms at all. So we've decided that they might spread it to adults, even though there's very little evidence of that. There have been very few cases recorded of a transmission in this way. And so we're going to shut all the kids down because they might get grandpa sick, even though until you're about 80, your risk of dying of this disease, unless you have pre-existing conditions, is very, very limited. Now, am I negating those things? No, but we need to balance it against these other costs. Many more people will die in an economic collapse. The CDC then tells parents how to talk to their children. It says, talk to the children about how some stories on COVID-19 on the internet and social media may be based on rumors and inaccurate information. Children may misinterpret what they hear and can be frightened about something they do not understand. How could you be more frightened than the CDC's position of having kids all, shut down? What's going on social media that is worse than what our government's actually doing, terrorizing children on all different levels? Isn't it frightening to tell children to shelter because they might die from a disease that kills fewer than 1 in a million of them? Is the CDC's advice more easily comprehended than the social media stuff they're told not to watch? They reported to the CDC that more than 81,000 opioid overdose deaths have occurred through May of 2020, and that, quote, the latest numbers suggest an acceleration of overdose deaths during the pandemic. Yes, This COVID aggravation applies also to suicides, economic losses, soaring national debt, anxiety and depression in children, and otherwise domestic abuse, closed businesses, a lot of other costs than just the one factor. We've heard so much about the racial imbalances of COVID. What about the children's imbalance? And by the way, when it comes to racial imbalances, that's attributed to increased mortality rates of blacks because of usually pre-existing conditions like obesity or diabetes. And if you question that, well, then you're called a racist because, of course, they have pre-existing conditions because of socioeconomic disparities that cause them to be more likely to have poor health. Well, there is some truth to that, but it's not the sole factor. And in fact, when you're pushing black people onto vaccinations, they have a history of not really trusting pharmaceutical and scientific industries that have subjected them to experiments. And studies show, science shows, that black people are much more vulnerable to side effects from these vaccinations than white people. So is it racist to give them the vaccination? It seems kind of racist to jump quickly to racist conclusions that are highly speculative instead of dealing with the evidence we have right in front of us about children. A recent Gallup poll found that Americans' mental health hit a 20-year low under COVID, and the CDC reported, quote, 1 in 4 young people considered suicide this past summer amid life under lockdown. 1 in 4. That's 25%. It's a little higher than the 1 in a million. Many in the mental health community warn that, quote, predictability is a stabilizing force for children and adolescents, but it has been disrupted since the COVID-19 outbreak. Yes, schools have been closed around the world, and we're just experimenting on children in waves we've never really studied before. So during COVID, also, if you look, you'll find dozens and dozens of major hospitals around America that opened up to adult patients. They were children's hospitals that were empty, that opened up to help adults, or virtually empty because no children were coming in with COVID. So once again, you see the children's resources being allocated for the elderly, which is fine, but they're empty because the kids aren't there. The children aren't getting sick, but massive resources are diverted to keep the very oldest and sickest of us alive at any cost. There's no Greta Thunberg on the horizon screaming angrily, how dare you? How dare you? Where's Greta? She's not at risk. She can come out and talk to us. But this is just a travesty what's happening right now. But the damages done presently to our children are not speculative. They're certain. They're evident. They're not 10 years down the road. They're now. So why are Americans not having this conversation? The CDC has statistics even on death from lightning. And we have to be careful because we don't know the actual stats with the virus, but it sure does look that like your child has more of a chance of being struck and killed by lightning than by COVID if they are healthy. Why are we shutting down their world and terrifying them? If it's not deliberate, then it's grossly negligent. So yesterday, Vermonters, the Vermont Racial Justice Alliance called for a national state race emergency because of COVID. It's a race emergency. No, it's child emergency. The evidence about race is highly speculative and minuscule compared to the very heavy evidence we do have regarding children and how it's going to impact children right now. And Susanna Davis says that the Global Warming Solutions Act is racist because it sets deadlines and that deadlines are racist. Well, do the kids have 10 years or 12 years? You're going to shift the deadline now over race because you're shifting their health on COVID over race too. Blinders on, and you're blind because Susanna Davis and the rest of you, you're the racists. Vermonters aren't racist. Our system isn't racist. You haven't proved that. We're not going to let you. But we can prove that we're totally dropping the ball in this state, especially for our children, because we're rural. We have very low infection rates. And we got kids staying home that aren't even infected because they went over somebody else's house that wasn't infected. Vermonters, get educated about what's happening right now. There's no leadership going on here. There is fear and failure. And there is either a deliberate effort to do so, or we are in bigger trouble when we come to look at our economy and our pensions and other problems going forward. Let's look at those together. Thanks for joining me as always. And tell your kids not to be scared of COVID.